All right, hey there, guys. We are on to round two now of trying to do our weekly office hours. Apologies for the technical difficulties, but it's the holiday time frame. We're into December, and we know a lot of people right now are actually looking into their health insurance renewals. And why is this conversation today going to be important? Well, most likely, your health insurance premiums have probably gone up, maybe another 10%. That's fun. It's fun when you get a 10% increase on your costs. And I think that just goes to highlight how broken America's healthcare system is. So if this is the first time you've seen me talking about this, I encourage you to definitely tune in every Wednesday. I'll be going live around 12:30 Eastern for about 30 minutes to talk about what's going on here. And if you're a business owner or an executive, you might want to take notice on this because we're essentially doing right now what Uber did to the taxi industry. The only difference is the industry we're disrupting is healthcare. And the old guard has been sitting around for far too long, just being greedy. We're here to change that. So today I'm gonna go through a few slides. I'm probably not gonna go through all of them, but I'm gonna go through a few slides to help you better understand why I'm so passionate about this topic and why I'm trying to help the everyday American get better access to healthcare for themselves and their family members while saving themselves money. And at the same time, guess what, companies? You save money too while still attracting and retaining your most important asset, which are your people. So let's kind of hop into a few things here. The first question I'd pose for you, and I know this is not a dialogue or a two-way back and forth, is do you think America's healthcare system is even easy to navigate? My guess is you would say no. If you say yes, please reach out to me. I want to understand why you think it's so easy to navigate because look around. People are struggling financially, and it is extremely frustrating to see how much bankruptcy is caused, because it's the number one reason. How much bankruptcy is caused in America by healthcare expenses. It's just sad, unfortunate. Again, why is this? Because of greed. But currently, you can look at the things on the page. If you think going to the ER is the right thing in the event of a medical incident or you're sick and just feeling unwell, you'd be wrong. Just get on the news outlets. You can look to see how long wait lines are all around the country for ERs. So not only are you waiting the longest, you're also paying the largest expense for an ER bill. What if you're trying to find the right doctor and facility, but you don't know the difference between in-network and out-of-network? Guess what? You'll quickly find out after you get that bill 45 days later explaining that, oh, you were out of network, you owe a lot more money. What about scheduling an appointment? A lot of people want to be able to see a doctor on demand, essentially. But then they try to see this doctor, and guess what? That doctor has a wait list. Did you know if you had an advocate, though, helping you navigate the system, you'd have a better chance of being seen by that doctor sooner rather than later instead of sitting as number 150 on a wait list of 150? So that's an important thing of being able to schedule an appointment by leveraging our network to be able to get you in where you want to be seen. Now, I'm not going to read everything here on the slide, but maybe a few other elements I'll point out. The first is getting upfront estimates on your costs. Oh, wouldn't that be nice? Show me any other business, product, or service that you utilize here in America where you don't know what the cost of it is before you agree to doing it. But yet, that's America's healthcare system. For some reason, the American healthcare system allows for you to get charged a expense that you don't even know what it's going to be until like 45 days later. It's like, oh, by the way, Dan, you owe us $1,500 for that visit. Oh, wow. That'd be great to know in advance. That's where we're helping kind of get ahead of the curve. We're helping people better understand if you want to get this procedure or get this type of care, just know that you have these 5 different doctors within your network, this type of availability, this type of quality of care, and oh, by the way, this is their cost as well. So then in that way, you can shop around and make the right decision for yourself and your family instead of just getting hit with a surprise bill that you have no clue where it's coming from. What about this final element on the page? Challenging incorrect medical bills. It's kind of like your credit card company. You can reach out to Visa, Amex, MasterCard, etc., and dispute a bill with a retailer. Well, guess what? You can actually do that with our medical partner, Amaze Health. So say you have a medical claim that doesn't make any sense. Great. Send it over to Amaze. They'll dispute it for you. 70% of medical bills are incorrect. A lot of us don't know that. We probably just pay the bill, or we don't pay it, and then we're in debt. So I go back to that question. Do you think America's healthcare system is easy to navigate? Hopefully by now, I think all of you guys are unanimously shaking your head. No, it's not easy to navigate. Well, let me show you a few other examples. If we think it was working well, then why would we have these situations? 16 states, probably more to come, but 16 states have filed class action lawsuits against the 3 biggest PBMs. Wow. Cigna, United Healthcare, CVS. Ooh, why would all these states be filing lawsuits if everything was working so smoothly and these companies were truly looking out for the best interests of the everyday American? What about the FTC? Oh yeah, they're suing groups like that too, accusing them of driving up the cost of healthcare here in America. Don't really have to accuse them. It's pretty much a smoking gun. So you've got the states filing lawsuits, you got the FTC filing lawsuits, and yet nobody is really hearing about this. I wonder why. Who are the insurance companies talking to, and who are those benefits administrators and insurance brokers indirectly kind of working for? Oh, the same company's getting sued, so of course they're not going to be highlighting the negativity around them. Instead, they're going to fight back against the programs that our group and others like us are offering out there, because they know they are so damn greedy that they don't want their profits to be hurt. So instead of actually helping proactively solve for America's healthcare crisis, they're just going to preemptively fight back against it as much as possible until that day comes when they now have to pivot and actually start offering those services free instead of charging for it. But you might be thinking, hey, I'm a business owner executive. What can I really do about it? I just have to rely on my benefits administrator. I have to rely on my insurance companies to be doing the right thing for my employees. Guess what? They don't have a fiduciary responsibility for you. So you can pass the buck as much as you want, but ultimately the buck does stop with you if you're a business. If you don't believe me, go ask Wells Fargo and J&J. Both companies now have been sued by their own employees for not covering their fiduciary responsibility to reduce the cost of healthcare for the everyday American. You can call it what you want, but a lot of it is just complacency. Maybe if you're in HR, you're just like, oh, I've already exhausted myself on the annual enrollment period. Okay, whatever you want to do. But know at the end of the day, you might be thinking entertaining new ideas when it comes to healthcare and benefits for your employees is a riskier decision, when in fact you are looking at it the entirely wrong way. It is riskier now for you to do nothing than to take action and consider new innovative medical programs outlined under the Affordable Care Act to reduce the cost of healthcare coverage for your employees. And as more employees in America become aware and overly frustrated with the cost of healthcare, I bet you they're going to start Googling around and figuring out, oh gosh, Wells Fargo got sued, J&J got sued. Oh, there's these systems in place. And more employees, by the way, are starting to get access to our programs. Imagine if those employees talk to another person that's working for a different company that's offering the solution, and they just so happen to be an unhappy employee at the current company. I don't know, maybe it's a lawsuit, or maybe better for the company, instead of getting sued, they only just lose that employee, which we know attracting and retaining talent is competitive and tough in America. So best case scenario, if you don't offer these types of programs, you're just losing the talent because other companies that are offering this are going to be able to attract and retain better talent because they're offering a better benefits package. Worst case scenario, you're going to turn into the Wells Fargos and the J&Js of the world, and you're going to get sued for this. Because if you take no action, you are taking a bigger risk as a company. Now, that's Dan Cosgrove's personal opinion, but sitting there and doing nothing is not the right choice. So what's the right choice? What's the right answer? It's an HCA, Healthcare Concierge and Advocacy Plan. What we are really doing is we are transforming the healthcare space, just like Uber did to the taxi industry. It seems new, foreign, and extremely scary. It's not. The people you're listening to are the ones telling you it's a scary concept because it's scary for them because now their profits are going to be diminished because all of a sudden they now actually have to compete. Because what are we offering here? 24/7, 365 telehealth in 80 different languages. Why is that important? Because we found 80% of medical needs to be done from the comfort of our own home, meaning you no longer have to sit in traffic to just go into a doctor's office to get hit with another copay and then recover. Or what about telemedicine? 60% of Americans need a prescription getting refilled on a routine basis. Well, now, again, instead of sitting in traffic just to get hit with a copay, you can now hop on our app, talk to our licensed American-based doctors and nurse practitioners, head down to your local CVS and Walgreens, and get your prescription filled, oftentimes at $0 copays. So that's table stakes right there, my friends. We're offering telehealth and telemedicine with that quality of care. And if you don't believe us, check us out on Trustpilot if you want. The business-to-business type for Yelp. 4.9 stars. So that speaks to the quality of patient care. Now, what if you have mental health issues? We're not just here for physical health. Physical health is very important, but mental health is just as important. Similar to telehealth on physical health, mental health, we can cover about 80% of medical needs. Now, don't get me wrong. If you have a major medical incident or mental health incident, we strongly encourage you to seek inpatient support. But at the end of the day, we can support 80% of mental health, from a psychiatrist all the way down to a peer group, 24/7, 365. What about preventative care assessments? Well, what's there is the ability for you, if you have like an Apple Watch or a Garmin, you can get a good idea of how your health data is tracking. Same thing. The only difference here is you can do a 60-second facial scan that gives you a read on your heart rate variability, blood pressure, stress index, oxygen levels, you name it. Absolutely incredible. Only difference is you're not paying for that. You're getting paid to use that. What about wellness education? Well, that's just a weekly email educating you better on the healthcare industry, because what you don't know will hurt you when it comes to healthcare. That is why healthcare expenses have gotten out of control. A lot of us just like to do the ostrich, bury our head in the sand and pretend like we don't know what's going on, and we just deal with the burden of the extra financial costs building up on us due to our healthcare system being out of control. The billing, insurance, and advocacy, I already kind of touched on that. We're challenging claims that are incorrect. We're helping you advocate and navigate through the system so you can get quality patient care at an affordable price in the time that you need it. We've got these hospital indemnity plans, which are a lot like what you see on Saturday and Sunday football with Aflac advertising with Deion Sanders and Nick Saban of they cover for the healthcare expenses that health insurance doesn't. Same thing. We're covering those out-of-pocket medical expenses that health insurance doesn't. And I'll show you exactly how that number kind of works. And then we got discounts on prescriptions, vision, dental. I mean, the prescriptions one is nuts. We are covering, the streaming issues continue to be bad for us. We're just going to have to go on. But we are covering 815 of the most commonly prescribed drugs at $0 copays. And then we've got other drugs like Ozempic that we can cover for about $500 a month, when the going rate on that is about $968. Wow. What about the financial advisor? So that piece is all about the idea of, we're covering physical health, mental health. Time for us to cover financial health too. And we work with financial advisors all around the country, and they have to agree to one core belief: no family left behind, no employee left behind. Meaning they can't just cherry pick the executives that are making $300,000 a year. They have to work with the entry-level employees earning $30K a year. Because at the end of the day, most employees are going to save about $2,000 to $3,000 a year, and they have every right to go spend that at the bar on Friday night. But we don't want them to do that. We want them to have a better opportunity for their future financially. So that's how we're covering them physically, mentally, and financially. Now, I want to share this slide. It's a lot of colors, but this will help you better understand how confusing our marketplace is, and almost by design. Now, every person here is going to be in that left-hand column. Every person, I hope, is using health insurance. It is important. I do not deny that. Are there ways you can reduce your cost of health insurance? Absolutely. But I'm not saying my program is going to replace health insurance. In fact, the IRS ruling on April 3rd has to make it clearly state that this does not replace comprehensive group health insurance. Good, we've got that out of the way. But you look at what your health insurance companies cover. And a lot of the times, you're still paying your monthly insurance premium whether you use it or not, right? And then you have your out-of-pocket expenses before any copay kicks in. A lot of times it's at least $2,000. Your maximum out-of-pocket is like $10,000. And then these insurance companies are adding in partnerships with groups like Teladoc for virtual healthcare. Well, guess what? Teladoc is convenient. And don't get me wrong, they are a well-respected group. Trustpilot says it themselves, 4.8 stars. They're a well-respected group. But at the end of the day, Teladoc is still charging the employer about $7 to $10 per employee per month to access said system, and they're still going to bill the insurance most likely from a medical claim perspective. So you're still being charged as the employer to offer the solution. Now, it is more convenient, and sometimes telehealth medical claims are lower than inpatient, but still, you're getting billed for it. Now, let's shift over all the way to the Health Concierge and Advocacy Plan. I do actually show one of our competitors out there, Champ Plan. I respect what they're doing. They too are after the same thing, trying to reduce the cost of healthcare in America and overcoming the old guard's objections. Now, here's a few points of differentiation. We cover a lot more languages. We got 80 plus. We also cover a lot more drugs, 815 versus 200. And not to mention, we've got those special discounts on weight loss drugs like Ozempic. We've got the free financial advisor, so we're focusing on financial health. We've got the hospital indemnity plan. So those are kind of the main points of differentiation. You're going to save about the same amount of money whether you're working with us or with them. You compare us to any of these other groups across the screen, and you can see why we are so much more effective. Like EAPs, employee assistance programs, much more common for larger employers, but it only costs you like $3 to $4 per employee per year. But oh my goodness, you have a 4.5% utilization, so no wonder it's so cheap. And do you really think if you're having a mental health issue as an employee that you want to notify your HR that you'd like to utilize the EAP to access a mental health professional? Absolutely not. So EAPs are there, they're cheap, they provide some of these options, but as you can see with the rankings, they're not really appreciated. Aflac, I'll show you that comparison there, but Aflac is more or less going to charge you to have their hospital indemnity plans. It might only be like $20 a month, so not a lot, but still that's $240 a year. And we're going to give you this for free. The telehealth, yeah, we're not going to charge you $7 to $10 per employee per month. We're in fact going to help you save about $500 to $600 per employee per year. So that's really the differentiation. It's really funny though, if you were to ask your health insurance companies or your benefits administrator, they would probably only put you into the first two columns of insurance companies and virtual healthcare. Maybe an EAP. They're definitely not recommending an HCA yet. Also probably because they don't know it, and that's not their fault. That's our responsibility. That's our industry's responsibility to get more information out there. So I do ask you, if you are listening to this right now, please forward this along to some people that you really care about. Because if you can help them get better access to healthcare for themselves, their family members, or their employees, we're all winning here then. And at the end of the day, don't we just want to minimize the pain and suffering going on in America? So that's kind of the main points that I wanted to talk about this week. Now, I'll click through maybe two more slides, because if you're sitting in one of these types of industries, know that you're in a sweet spot. So whether you're part of a logistics company or an academic institution or local city government or a logistics company or fast food industry, hotel industry, like those type of hospitality type elements where you commonly have a lot of part-time workers, high turnover, great. This is a great solution to augment onto what you're providing as a benefits package that can help you retain more employees. Or what about a staffing company? Now, these are just some of the warmest markets that we found a lot of success with, because as you can see, we've helped a lot of companies and a lot of employees. If you are at a company outside of this industry, doesn't matter. We can still help you. The main thing that is standing between your company being able to access this is really the willingness to consider an alternative of something in the healthcare industry. And if you're not willing to at least educate yourself a bit, instead you're going to defer the responsibility to these benefits administrators, insurance brokers, etc., that have no fiduciary responsibility to help you and your company, then ultimately you are doing yourself, your company, and your own people a major disservice. So please, you know where to find us, wellnessfortheworkforce.com, or you can contact our general email at info@wellnessfortheworkforce.com, info@wellnessfortheworkforce.com. And if you guys know me well enough, then you can just DM me privately on LinkedIn, and we can try and find a time to talk specifically how this pertains to you and your company. Thanks so much, guys. I wish you a healthy and happy holiday season. We'll be back next week to cover this in more detail.